Hello, my name is Chip, and I'm a paramedic instructor in North Carolina. We're going to talk a little bit about on what the layperson can do to treat a mini stroke. A mini stroke is simply just that. It's a mini stroke, also called a TIA or transient ischemic attack, which simply means that there's been an interruption of blood flow to the brain and is thus called some kind of weakness or deficit on one side of the body. Most people will present with a little bit of confusion and weakness, maybe not quite the muscle tone on one side of the body. But one of the good things about a mini stroke as opposed to a full-blown stroke is typically they recover 100%, and that's why it's a mini stroke and not a full-blown stroke. So they'll regain function of their arm and of their facial muscles and things like that down the road. Your initial treatment, if you identify one of these, is simply to activate 911 immediately, have the patient sit down or lie down if they're not already doing so, and make sure they're breathing okay. Make sure that their head is not in such a position to where they're going to have problems breathing. If they're sitting in a chair, there's a good chance their head might relax and lean forward. If that happens, it can shut their airway off. So make sure their head's sitting back. Maybe that's in a recliner chair, or lie them on the ground or a sofa. Maybe put a pillow behind the shoulders and head to make sure the head's in a neutral type position. That way you can maintain that airways good. Also, when you call 911, many areas have something called EMD, or emergency medical dispatch, and they'll actually give you instructions on what you can do to help that patient while the ambulance is on its way. My name is Chip, and this has been how a layperson can treat a mini stroke.